ethical values in health and social care. The script is authored by Abraham Bola Lawal, lecturer in health and social care, and the video is produced with the use of artificial intelligence technology. What is ethics? What are values? What are the ethical values in health and social care? How are ethical values handled when they conflict with own values? Aims of this lesson: to differentiate personal values from organizational values, to deepen the participants' understanding of core ethical principles guiding the health and social care, to ensure participants' understanding of the person-centered approach to health and social care delivery. What are ethical values? Ethical ideals guide business practices, defining what constitutes acceptable or desirable behavior, in addition to compliance with applicable rules and regulations. It is possible that the values of the organization are implicit rather than stated. What are individual values? Individual values are what motivate people to act in certain ways. They provide direction for human behavior. By and large, people are predisposed to adopt the ideals instilled in them during their formative years. Additionally, people believe those values are correct since they are the values of their own culture. What are the ethical values in health and social care? Some ethical values underpin the delivery of care and are linked to dignity. The ethical values in health and social care provision include respect, compassion, safeguarding, beneficence, non-maleficence, confidentiality and data protection, privacy and dignity, empowerment and autonomy, justice, freedom of choice, human rights, and the duty of care, among others. Respect is one of the ethical values in health and social care that can really propel service user well-being when accorded. Respect is driven from the application of the principle of equality and diversity and inclusiveness, meeting the service user's needs and expectations within the law and service provision are integral to their fulfillment and satisfaction. It will lead to a service user feeling of being respectful and a mark of dignity. Prioritizing respect in an organization as a code of practice enhances staff and service users' relationship, as has been evidenced in research. Respect is also given more credence as a fundamental sign of quality service by health and social care code of practice, according to the World Health Organization in 2002, the Code of Conduct for Nurses in 2015 and 2018, and Baldwin in 2008. Compassion is an essential ethical value in health and social care. It entails putting yourself in the position of a service user in the delivery of care, empathizing with the service user, listening to them and their families, valuing their opinions and contributions, and taking seriously any of their complaints, concerns, and expectations. This is important because it promotes the interpersonal relationship. It enhances service user participation and cooperation in their own care. It fosters rapport and builds a therapeutic relationship between the carer and the service user and fosters their dignity, according to Gilbert in 2019, the Nursing and Midwifery Council in 2018, the Care Quality Commission in 2009, the World Health Organization in 2002, the CARE Act in 2006 and 2013, and CAPA in 2008. Safeguarding is an ethical value in care that is very crucial. The purpose of safeguarding is to provide safety from any danger and protection of service users from any abuse, be it physical, emotional, sexual, financial, and neglect. Service users' level of dependency and need for support varies according to their mental capacity assessment and physical mobility level. The higher the level of dependency for supports, the higher the level of vulnerability to abuse. Hence, safeguarding legislation was introduced to protect the service users as a value to care provision. Safeguarding Vulnerable Act 2006 and Child Protection Act 2006 are legislations enacted for clarity of purpose, prevention, and accountability with the consequence of any incidents of abuse, according to Barnes et al. 2015 and CQC 2018. Autonomy and empowerment are crucial in health and social care for service users in person-centered care. It encourages individually planned activities. It helps to promote choice and involvement in decision-making by the service user. It induces self-confidence, self-esteem, and self-worth, which are essential requirements for improving the well-being of service users, according to NMC 2015 and 2018. Human rights, justice, and freedom of choice are ethical values that promote service user dignity in health and social care. Justice is the ethical value that stresses on the fairness of action towards the service user. There must be uniformity in the way care is provided without favoring a service user over another, irrespective of their status or challenging needs. Human rights as an ethical value in health and social care are certain entitlements valued and considered fundamental to the human being. It is recognized by the Human Rights Act 1989 under the United Nations auspices, and prominent under the Act is the human right to privacy and dignity, self-determination, and health. Freedom of choice is the driver of autonomy and empowerment. The equality and diversity, the cardinal principle in health and social care. Freedom of choice enables service users a variety of options to choose from without being forced to take a particular choice against their wish. A patient or service user has the right to refuse treatment if they have the capacity to make such a decision. They equally have the right to refuse medication. However, the staff responsible for the discharge of such duty must ensure that the refusal is documented in written form and, if possible, witnessed by another staff in case of any future inquiries of why those treatment or medication are not given. Privacy and confidentiality are key ethical values in the provision of care. The privacy of the service user is a policy that must be kept in every care or nursing home setting according to the care quality control requirement. Every service user must have a room, and there are rules guiding access to rooms by staff. You cannot barge into a service user's room without seeking permission to enter. No matter the level of the capacity of the service user, you must knock on the door and wait for a response to come inside before doing so. Even if your service user is unable to speak or has auditory problems that they cannot hear, you still owe them the responsibility to knock on the door first before going inside the room. Confidentiality is an ethical value in health and social care aimed to protect people's dignity. It entails keeping the service users' information secret and safe, including their details and medical records. These can only be released with individuals and their families' consent, except in overriding public interest such as a court request or to save lives. Violating patient confidentiality may lead to criminal prosecution according to the Care Quality Commission in 2018, the CARE Act of 2006, and the Safeguarding Vulnerable Adults Act of 2006. Beneficence in person-centered care in health and social care. Beneficence is a crucial ethical value used in care plan assessment, also known as the APA model. The beneficence principle connotes that whatever decision is made in providing care to a service user must be in their interests and of utmost benefit to them. When there is a dilemma in decision making, the cost and benefits analysis of the situation is used to determine the service user's utmost benefits. Every decision taken with or without the service user in their care must always be of the utmost benefit to the service user, as stated by the NMC in 2015 and 2018. Non-maleficence. Non-maleficence is the ethical value and principle in health and social care, which entails that the service provision providers to the service user must not harm them. This simply stated principle supports several moral and legal rules. Do not kill, do not cause pain or suffering, do not incapacitate, do not cause offense, and do not deprive others of their good of life. Duty of care is an important principle and guide that mandates health and social care providers to provide quality care to the service user. It is a lawful duty with legal consequences if they are not carried out properly by service providers. All members of staff and people responsible for service users under their care owe the service user a mandatory and obligatory duty of care that guarantees service user safety and outcome satisfaction under their care. In conclusion, the advantages of your organization's adherence to ethical values and principles in health and social care include enhanced service user satisfaction, a reduction in staff turnover, improved relationships among staff and service users, and decreased costs associated with potential litigation arising from neglect or abuse cases. It will also enhance your organization's profile and improve its rating from the Care Quality Commission, the regulatory and rating agency for health and social care providers in England. Take care of yourself and thank you for your time.